Good afternoon and welcome to the COVID-19 update on Channels Television. It's a daily update on the coronavirus pandemic in Nigeria and across the world. I'm Millicent Walker. First, some of the highlights. Today, Nigeria among top 5 African countries as COVID-19 figures hit 3,145. Kano remains an endemic state with more people testing positive for COVID-19. And first, Nigerian evacuees from the UAE return to the country. Now, when coronavirus disease hit the global scene, most medical practitioners were taken by surprise. But as the toll was felt across the world, universities, research institutions swung into action, searching for solutions. Today, there are reports of some vaccines undergoing clinical trials, even as the World Health Organization and other bodies are calling for scientific findings and knowledge on COVID-19. Nigeria is not left out in the search for a vaccine on the coronavirus. Our theme today takes a look at the pieces of the puzzle as more of the virus mutations come to light. Nigeria now has a total of 3,145 COVID-19 cases following the confirmation of 195 new cases by the Nigeria Center for Disease Control, NCDC, last night. The center also confirmed that 534 patients have been discharged from various isolation centers, and a total of 103 deaths have been recorded. A breakdown of the 195 new cases show 82 are in Lagos, 30 in Kano, 19 in Zamfara, 18 in Sokoto, 10 in Borno, 9 in the FCT, 8 in Oyo, 5 each in Kebbi and Gombe, 4 in Ogun State, 3 in Katsina, 1 each in Kaduna and Adamawa states. The nation's commercial capital, Lagos, remains the state with the highest infections both in the southwest and the country, with a total of 1,308 cases, followed by Kano in the northwest with 427 cases. The FCT in the north central still maintains third position with 316 cases, while Borno has the highest figure in the northeast with 116 cases. Edo and Enugu states, which still leads in the south and southeast, with 65 and 8 cases respectively, did not record new cases in the last 24 hours. And News In says the SAG Commissioner of Works and Infrastructural Development in Kano State, Mr. Mwazu Magaji, has tested positive for COVID-19. Mr. Magaji was sacked over his Facebook comments to celebrate the death of late Abba Kyari, Chief of Staff of the President, which he denied. In Kano State, a total of 6 persons have recovered from the coronavirus in the state. Only yesterday, Kano reported 30 new coronavirus cases, while 5 patients were lost to the virus. This has raised the death toll in the state to 13, the third highest death toll after Lagos with 30 and Borno State with 14. According to the NCDC, now Kano State has about 408 active cases. Now, Dr. Rosemary Aldo is the Deputy Director of Research. She has a PhD in medical microbiology with virology specialty. She joins us today. Her research interest includes HIV, viral hepatitis, human papillomavirus. She's been involved in training and providing proficiency panels for HIV, TB, and malaria. She joins us in the studio. She's also a member virologist, the Nigerian Institute of Medical Research. That's NIMR. Thank you so much, ma'am, for joining us on the program.
It's a pleasure.
I hope I got all that right, and I'm sure many more.
That's okay.
All right, tell us how far medical research, or rather the institute now in Nigeria, has gone in terms of identifying first the type of strain of COVID-19 that we have.
All right, thank you very much. I'm quite excited that we are involved in this pandemic, response to this pandemic. It all started last year, 2019, when 2 of our staff went to China to train on some techniques. And then we had 3 other staff that went to Institute Dakar in Senegal, also to train just for technology skill acquisition. And as soon as they came back, we had to, by November, we had to come together and see how we could prepare for any viral outbreak in Nigeria. You know, it was in getting that ready, getting the kits and all the primers ready. You know, we didn't know, COVID had not been announced then, and suddenly we heard that there was this outbreak early in January of coronavirus outbreak in China. And since we already were collaborating with China, we were able to get some test kits, and we already had primers, we're just ready. So when the index case was announced, NCDC, at that time, my Director General had gotten in touch with the minister to say, NIMA is prepared to respond to this outbreak. So we got some sample from this index case. We tested, it was positive, so our kits were okay. And then we went ahead to sequence it. And within 3 days, we completed the sequencing. It was a part genome sequencing. And we found that the strain that we had had 98% similarity with the one that was reported in China. And after this, we have been sequencing, you know, monitoring the sequence to see if there is any change. But we have found that it's a conserved region. It's not changing as such. It's not mutating. So we are monitoring to see if it's mutating because, of course, it's going to impact diagnostics and it's likely going to impact treatment. So we just need to keep monitoring. As we speak, we will soon upload our full genome sequence, sequencing the entire virus from one end to another, just monitoring, and this we intend to do. This is our own contribution. And then in doing that, we also had companies contacting us, even before the first index case was reported, that they had some workers from China that had arrived. We should please screen them to know that they are free of coronavirus. That we were doing, and we had some NGOs partner with us to install this, to establish a drive-through. We modified it a little. It's a drive-through and a walk-through facility for sample collection. So we collect samples and we test. Within 24 hours, we release the results. And then
That's just in Lagos? In
Lagos, in our institution in Lagos. So that's part of the response we have had. And along the line also, at the Nigerian Institute of Medical Research, because we were collecting samples, we were preparing our own transport medium. And later on, we discovered that at the national level, they had run out of this transport medium. Importing these items are really very difficult because the whole world is asking for it at the same time. So we now are producing viral transport medium for this outbreak. We're supplying to other institutions who ask for it.
Across Nigeria?
Yes, across Nigeria.
There's something a number of people are witnessing, and some people are wondering, because we're having like a lot more health workers infected with the virus, and many people are wondering now, is it that there is scarcity in the PPEs or diagnostic tools, or what we're getting are actually inferior and they're not protecting our health workers?
Thank you very much. You must know that this virus spreads really, really fast. And I must tell you that the PPE that they wear, when a scientist dons on it or a doctor dons on it, it costs 45,000 naira, just one wearing it, And if 4 or 5 people wear it, you can see it's quite expensive. The quality we have is the standard quality, but it's expensive. And I guess it's because we have NGOs partnering with us that we're able to get this supply, and some more people are coming to support us. But in facilities, and apart from that, you are an institution that wants to respond to COVID outbreak is necessarily required to do a risk assessment before starting. It's encouraged. You do a risk assessment, see your system, where do you think you have gaps, and then you provide solutions to bridge the gaps. And the infection prevention and control system must be in place whereby they monitor even the health workers, like in our facility, for instance, our infection prevention control team, they monitor us daily. We have forms that we have to check. If there is any symptom, immediately you go test and all of that. So it's close monitoring. Those who collect the samples, after collecting from 5 people, for instance, they come spray around. So it's intensive. You just need to, it's a battle, I just say, it's an invisible one. You don't get to see. Many people, some people say they don't believe it. Unfortunate, but it's just we're fighting an invisible battle. So we just have to be really prepared.
We have a few minutes before we let you go, and I just wanted to quickly get the latest on the test trials on the efficacy of chloroquine. I understand the Institute was working on that.
Yeah, we are working on that. We have gotten an approval. The Institute is working together with Lagos State on this. They are yet to start administering these drugs in the trial, but it's about to commence. Any moment from now, it will commence.
All right, we appreciate your time. Professor Rosemary Awudu, virologist with the Nigerian Institute of Medical Research. Thank you for joining us on the program.
It's a pleasure.
Now, the Edo State government has intercepted 2 trucks carrying over 100 persons to different locations in Irua and Benin City. The travelers were profiled, their samples taken and sent to the Nigerian Center for Disease Control for testing. The chairman of Esa Central local government area explained that the truck was detained for going against government's restriction of movement order.
A roll call for samples collection at the Irua Specialist Teaching Hospital, Irua, in Asan Central local government area of Edo State. The health facility was not the destination for these travelers who were passing through the state. However, their journey was cut short for traveling at night, violating the curfew imposed by the state government to help curtail the spread of COVID-19. In spite of the travelers' frustration, the local government authorities insist that they undergo profiling and submit their samples.
Our security men that mounted different locations to enforce the decision of the federal government and the decision of the state on movement, restriction of movement in the night, saw them. We were able to bring them and keep them here, depending on when we hear further directive from the state government.
At the Stella Obasanjo Hospital in Benin City, another set of travelers face a similar challenge. But cheering news for this group is that they will not wait for too long to know their fate. The Edo State Governor, Mr. Godwin Obaseki, arrives at the facility for an inspection, and the matter is brought before him.
Yanzu kenan aka bar ku za ku shiga mota ku wuce straight ba wanda za ka sauke ana. So they are allowed to pass. None of them is dropping here. All of them are going to Zaria.
Governor Obaseki is satisfied with the explanation and asks them to continue their journey with the police escorting them out of the state. For the Edo State government, the borders cannot be closed because of the state's strategic location, being a gateway to many other states. But it maintains that all travelers would undergo proper screening before being allowed to pass through.
Welcome back. Religious leaders in Enugu State have urged residents to continue to abide by the rules and regulations of the NCDC, as well as all other precautionary measures aimed at containing the spread of COVID-19. Addressing newsmen at the Government House after a closed-door meeting with the Governor, the Catholic Bishop of Enugu Diocese, Most Reverend Callisto Zonaga, told journalists that they agreed to partner with government and ensure that the social distancing protocol is adhered to by the members. The Bishop also called on the need for prayers for God to cure and end the disease so that life can return to normal. The Federal Road Safety Corps in Delta State says it is playing its own role in preventing the spread of COVID-19 in the state. Acting Sector Commander in a brief in Asaba disclosed that the Corps is ensuring the enforcement of the no face mask, no movement law especially with motorists and commuters. It says they are not exempted in the law, as every officer on the major highway must adhere strictly to the law before ensuring its enforcement on motorists. Overloaded vehicles are also being apprehended through the mobile court, and violators sanctioned according to law. In Abia State, the state's Border Security Task Force apprehended trucks carrying suspected almajiris being smuggled into the state. The government had earlier imposed some restriction on the movement around its borders to prevent the spread of COVID-19. And the Nigeria police is assuring an increase in patrols to ensure compliance with new restrictions imposed in Nasarawa State to contain the spread of the coronavirus. The State Commissioner, Mr. Bola Longe, revealed this while briefing journalists after a stakeholders meeting in Lafia. He added that there won't be a hesitation in the arrest of violators. And indeed, how can we flatten the curve? A clinical pharmacist and chairman, Association of Hospital and Administrative Pharmacists of Nigeria, Dr. Titilayo Onedo, joins us on the program. Thank you for coming.
Thank you for having me.
Tell us what you think about the new normal for Nigeria as government eases the restrictions. How do you think Nigerians can manage to slow down the infection?
Okay, thank you. I would actually want to say the ease of the lockdown was actually brought about by the pressure of people on government. And it's just normal for us all to expect a spike in this the spread of this infection. More so going by what we saw the very first day the lockdown was eased on Monday, we saw a lot of people, even though some were donning their face mask, but they were not taking other necessary precautions. They were not maintaining social distancing and so many other things that they did wrong. So definitely we expect that the figures will increase, but well, there's still a way forward. And one way forward I would want to suggest to the government is partnering with the community pharmacies. I think we cannot run away from partnering with the community pharmacies in the control of this.
What role can the pharmacists play in this fight?
Okay, for the community pharmacies now, they can help in infection prevention and control, whereby the spread that is already being witnessed now, because it's already in the community, and you know, these people are very close to the community. They are mostly the very first point of call for the people in the community. So government should train them in infection prevention control and should even empower them in testing using rapid diagnostic test kit, because we know already that it's like we don't have enough of this testing kit. So if we go using the rapid diagnostic test kit using the community pharmacy, I think it will go a long way in curbing the spread of this infection. More so, if this is not done early enough, the healthcare practitioners may be overwhelmed. And also, there may be some kind of challenges to the regular supplies of some medications used in the management of these COVID and PPEs.
What do you think about accreditation? Because the PTF has talked about that. They also mentioned hospitals who are not accredited to handle COVID-19 that they need to be properly trained on how to do this. So perhaps approaching the government, has that been done? I mean, you're the chairperson for Lagos. What's the relationship with the Lagos state government with regards to the efforts on the pandemic?
Okay, on the accreditation, that's the way to go. They have to be accredited, they have to be trained, and I think the larger PSN body is still engaging the government on the way forward. But like I said earlier, we can't run away from it, because if care is not taken, we'll be overwhelmed.
All right, we'd like to thank you, clinical pharmacist, chairman, Association of Hospital and Administrative Pharmacists of Nigeria, Dr. Titilayo Onedo. Thank you for joining us on the program.
Thank you.
And South Africa tops the list of most affected African countries with 7,808 confirmed cases of COVID-19, followed closely by Egypt with 7,588 confirmed cases. Morocco is the third most affected with a total of 5,408 cases. Algeria has had 4,997 confirmed cases so far, and Nigeria is in fifth position with 3,145 confirmed cases so far. You can see on your screen the 5 most affected African countries, with South Africa leading that group and Nigeria at number 5. The voluntary returnees from Dubai are undergoing mandatory isolation after a chartered plane conveying them from the United Arab Emirates arrived at the Murtala Mohammed International Airport, Lagos, yesterday evening. The flight, which was originally scheduled to arrive at about 3 p.m., but suffered a slight delay. Our correspondent, Bukola Kitumbi, monitored the return of the evacuees and reports.
One after the other, Nigerians evacuated from the United Arab Emirates step on home soil into the embrace of officials of the Nigerian Immigration Service. 256 of them moved to the profiling table, which is out of sight to our cameras. When the profiling is over, they will also be seen by officials of the Nigerian Center for Disease Control, who will then lead them to the isolation centers for the 14 days quarantine. To keep to the rules of safety at this time, men dressed in personal protective equipment attend to their luggage. Left to the port health services and those who are related to health to take them to the isolation centers. They have not told us where the isolation centers will be, but I know that the Nigeria Diaspora Commission or the Ministry of Foreign Affairs had issued earlier was that they were going to be isolated in different hotels across Lagos. This is the first flight that has brought stranded Nigerians back home. One other flight is expected between Saturday and Sunday this week. From the Murtala Mohammed International Airport, Bukola Kitumbi, Channels Television News.
And the United Nations official Mark Lowcock warns that the coronavirus could cause multiple famines. The UN is appealing for billions in funding, adding 9 nations to vulnerable lists, including Pakistan and the Philippines. Take responsibility in protecting your health. It's a message from the NCDC. It says practice physical distancing, no contact greetings, maintain at least 2 meters between yourself and others, stay home if you feel unwell, no religious or social gatherings, call your state's hotline. The website has all the information and statistics that you need. Also, the World Health Organization has rolling updates on the pandemic, the World Health Body's strategies and plans on the coronavirus. So that's our COVID-19 update at this time. Thank you for watching. Another update comes your way again at 6. I'm Millicent Nwaka. Bye for now.